why the reason why we want to build this center, because this is going to be a community care hub where, say like, because by building this, we'll be able to promote the population health as a whole.嗱，咧我哋點解要做咧？就係提升咧我哋整個人口咧個健康。Secondly, we also want to help the government to increase the social healthcare system's cost efficiency. 我哋第二個目標咧，就係我哋想幫助咧我哋嘅政府咧。Okay, another question. Guess how much Ontario government is spending our budget on health services? Physicians, sit your lips first, okay? Because probably you know the answers. So do you know how much our government spend on our healthcare, services? The whole Ontario budget. What's the percentage?
Over 50.
Over 50%? Okay, so 50%. Any other numbers? Huh? 多少?
46.
Huh?
46.
46? Okay. Okay, can I have one more guess?
60%.
60%. Simon is right. Actually, no one, Tony is right. Basically, we say like, we don't, it's really a surprise, right? We spend 60% of our total budget on healthcare services. You see how such a big investment our government in our healthcare services. So, but somehow they find somehow the balance is maybe go out of whack because if it continues to soar. So what's remaining for the other development? Because healthcare dollars already use up 60%. 院長，我用中文解釋俾你聽，特別要尊敬你咧，解俾你同埋黃太聽，兩位咧係黃太。咁呢兩位黃太講中文咧，就係話點解咧？我哋要起呢個中心咧，就係因為咧，我哋政府咧一年咧係用咗咧差唔多60%啊，安省政府啊60%咧，我哋成部嘅收入咧擺咗落個醫療體系，即係話個醫療體系咧就好嘥錢，同埋用得好錢咧用得好勁。咁所以咧，佢哋話將來咧如果繼續咁用法咧，就係咧我哋咧嗰個咧醫療體系咧同埋咧安省政府咧會破產啊！所以咧就係話咧要慳錢啦，咁所以咧我哋起呢個中心咧，其實咧個目的都會係幫政府慳錢嘅。So basically what we are trying to do is to help to increase the healthcare system cost efficiency, and most important of all is to improve the patient's experience so that they get really better. The most important one here is integrated care， 係有聯繫嘅，呢個中心咧就會提供有聯繫嘅護理服務嘅。Okay, let's move faster. So, Carefirst right now, we are providing this basket of services. When we move into the center, we will be able to provide even a fuller basket of services. So look at Carefirst, how full is the services we are providing. For instance, we have the adult day centers, we have all the chronic disease management programs, and then after finishing the center, we will be having a bigger family health center, a family health team, even a bigger operation in Scarborough. And then we will also draw in, say, like related businesses like pharmacy stores, dental office, rehabilitation service, and the most important of all, and the one of very unique feature is the short stay transitional care. 嗱，我哋呢個中心咧好特別嘅，入邊咧就除咗咧耆輝會而家咧提供緊嘅服務之外咧，我哋入邊咧就將會咧一個更加咧係大啲、龐大啲嘅咧係家庭醫療中心。將來咧我哋咧就係會有咧係一啲咧同我哋服務有關係嘅藥房啊、牙科診所啊。最特別咧，將會咧係有一個咧係29張床位係暫住服務嘅 transitional care actually will be working together with the hospitals to look after those patients who are ready for discharge. And even before they go home, they just get a short period of convalescence at our transitional care, and then they go home with the whole basket of services. And that somehow will help reduce the visits to the emergency department and reduce patients' rehospitalizations. 嗱，個好處咧就話將會咧幫政府咧係減低咧嗰啲人咧，即係咧如果有好好嘅安排咧，佢哋唔使成日要翻去醫院，同埋唔使成日咧去急症室。Okay, next slide. So I won't repeat that because the earlier slide talks about it's an $18 million investment. And right now, so Carefirst, 嗱我哋一共咧係要18個 million 啦。咁咧 Carefirst we have to commit $6 million ourselves. So right now for the $6 million, we are only say like $350,000. I mean short from the shortfall, say like to meet the $6 million. So we are very proud to have, right? This is right, George. It's a very important information, George. You have to verify this. It's an international renowned builder, right? Multiplex film.
Yeah, we operate in the Middle East, Europe, Australia, and now Canada.
And I also understand, say like Hong Kong. I mean, you also participate in building that big bridge.
Yes.
Right? So that's why we chose you.
So Multiplex is an Australian company that was bought by Brookfield, who are a Canadian company back in 2000.
Thank you. That's good. We have a good choice. Okay, moving on. So where are we at right now? We're very close to the $6 million, so only $350,000, I mean, short. But we are going to make it after the gala if you donate more. Okay, so somehow there's a continuing exercise, is the naming rights. Actually, we are still looking for donors who would like to say like have some sort of, when you want to say like somehow become legendary, say like if you want to somehow devote and commit some donations to, well, sometimes it can be in memory of your loved ones, family members, so we still would like to welcome say like generous donation towards the naming of some of the facilities within the building. And also, other than the premises itself, we can also say that have the furniture to be named after. Say that if you want to say like donate and would like to have a good memory of it, so we welcome say like also furniture naming. There is a naming campaign. 嗱，咁除咗咧，我哋捐錢咧係可以咧，就係話有啲地方係可以咧係跟你嗰個即係善長係紀念佢啊，或者咧我係唔想係地方咧，我哋有好多嘅家具家私啊，又可以咧係捐助嘅。So this is the timeline. So most important of all is pay attention to the last line. So the last two lines is that we expect the construction complete, but though this is the proposal from Brookfield, we want to say like have to move it earlier than May 15. So we hope that it will be completed even before May 15. George, right? You're not looking at me. 嗱，我哋咧就時間表黃院長啊，第日咧都可以近啲用啊，因為你哋咧嗰個寫字樓咧響 Steeles 咧，離呢個中心近啲啊，院長睇醫生。咁咧就咧嗱，5月中咧就起好啦。咁咧就我哋預算咧就係咧暑假咧就咧係即係搬入去啦。咁咧，然後咧就即係咧跟住暑假之後咧，我哋咧就正式咧就喺嗰度咧係運作㗎啦。咁所以第日咧，如果去睇我哋嘅醫療中心咧，院長去做運動都得㗎，但就唔係健美，唔係你嗰啲，我哋就係做物理治療嗰啲。咁咧就係咧就可以近啲喺嗰度，就乜嘢都有嚇。院長，第時咧你可以嚇，多謝晒院長。OK，next slide。Now, this is when we had the groundbreaking in November 2013. So the progress here, September, December. Actually, this is January. So where are we at right now? So this is almost like done, right? So any more photos? No more photos. So